Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
A 22-year-old woman came with treatment of hirsutism. She is obese and has facial acne, hirsutism on her face. LH level is 36 international units per ml and we have FSH of 9 international units per ml. Okay. Then androstenedione and testosterone levels are also elevated. Serum dihydroxy epiandrosterone levels are normal. The patient does not wish to conceive at this time. Which of the following is the most appropriate treatment of her condition? So, hirsutism with obese and facial hair and LH level is 36 milli international units per ml. That is, there is increased LH and there is decreased FSH. Androstenedione and testosterone are also elevated. Serum dihydroxy epiandrosterone are normal. Patient does not wish to conceive at this time. Which of the following are the most appropriate treatment for this condition? So it is actually a case of PCOD. Hirsutism with increased LH, decreased FSH, increased androstenedione and increased testosterone. All this is polycystic ovarian disease. In polycystic ovarian disease, the treatment is oral contraceptive pills are given. Then a patient is having hirsutism with altered LH by FSH ratio. This is FSH. Probably the case of PCOS, the first line management is OCPs are given.
thank you and thank you for watching.